They check my height every single time for the past number of years. I won't say how old I am, but is that really necessary? There's a nervousness there to hand over control to a machine. They'll not lose it to AI. They're going to lose it because they're not using AI.
Yeah. This is the Future of the Future show. I am your host, Mateo Berbejicio. For decades, healthcare treated patients like passengers in a system they didn't control. Long waits, limited transparency, and very little choice. But that model is starting to crack. Today, we are exploring what happens when healthcare starts treating patients more like consumers, people who expect clarity, convenience, and real agency over their care. What role does technology play in making that possible? How far can AI go in transforming the patient experience? And where does the idea of consumer healthcare run into the messy reality of life and death decisions? To unpack all of that, I am joined by Josh Marquart, a healthcare and technology executive who has spent years working with providers, health systems, and digital health platforms to rethink how care is delivered and experienced. Josh brings a deep perspective on how policy, technology, and patient expectations are colliding and where healthcare is headed next. Josh, thank you so much for being here.
Thank you, Mateo. That was a great introduction, and I'm excited to talk to you and see the podcast go out.
Awesome. Let's get started with the very basics. What do you do today for a living, and what is your story in the tech world?
Sure. I've had a long career within the tech world, primarily in healthcare, although I've had a few excursions into other businesses, but well over 20 years working in healthcare, to your point, both from a payer perspective as well as provider and digital therapeutics. So I've had the opportunity to work very closely with innovative programs that have never been done before on digital therapeutics, as well as both as a client and as a consultant for those. So throughout my career, I've moved through project management on up to people management and leadership positions. Most recently, running the Americas division of our company, which was about 112 million in revenue. And now I am ready to get back into the product space and looking to make that happen. That really gives me a lot of passion to see people get better.
Exciting times ahead. Josh, in your own words, what does it mean to treat patients as consumers in healthcare, and how does that differ from traditional patient views?
Great question. The experience that many of us have when we go to the doctor is that things are being done to us. And even when we're creating apps or technology for them, the doctors often want to gather all of this information and what's in it for the consumer. I think you and I have both been to the doctor. They check my height every single time for the past number of years. I won't say how old I am, but is that really necessary? And of course it is. But if we treat it from a consumer perspective, I went in for a particular reason. Let's start with that, right? Let's ask the questions where I'm going to be engaged. Otherwise, it's a big time suck for me. And I don't get a lot out of it. And with the limited amount of time that doctors have, they come in, they haven't really read anything about me. They ask me the same questions the nurse just asked me about, and they don't know the history, et cetera, et cetera. And from a consumer perspective, that's pretty much the opposite of any other app or any other experience that we have. Right. And with the generations coming through and my own experience, I'd much rather have somebody that knows me and get right to the point to get help. And when we treat our patients or potential patients as consumers, it really changes that dynamic. Meeting them, it's a little bit of a cliche to meet them where they are, but it's extremely important from a total consumer experience beyond how the screen looks and clicks, but rather how do you invite people into that experience and get the behavior change that you're trying to get out of it. Ultimately, that means trusting the patient. Like when we come in, you come in, Mateo, we know the best about how we feel, better than anybody else and what's going on. Trust the patient to tell you and trust the patient and encourage them to share more than they normally would because every single thing they say is a little bit of a clue as to what's happening. So those are some of the things I immediately think of. Um, when people get what they need, where and how they need it, that could be virtual and should be virtual wherever possible given our busy lives. And when it does need to be in person, scheduling should sure be easier. Getting into your doctor here is very, you can wait a long time. So those immediately are some pieces that I come up with, Mateo.
So when we talk about this, some critics would argue that patients aren't traditional consumers, right? Because health decisions many times occur amid vulnerability and urgency. So how do you reconcile this with the idea of consumerization in healthcare?
That's true. When I go to the emergency room with my kid, which I've done a couple times, it's ruled by emotion and love for my kid. It's not ruled by, is this the most cost efficient path for my kid to go when they need emergency care? It just doesn't work that way. However, most healthcare is a non-emergency perspective. So I go in for my checkup. I go in for, this thing looks funny, please take a look at it. In that case, knowing your patient, what they're coming on up with, what's their background, do they speak English, and so on. If I know all of that ahead of time and I'm prepared, I can treat that patient very, very well, bring down any fears they might have. And some populations do have fear of doctors based on what has gone on in the past in the US. They feel the confidence in their doctor, and so they're going to follow what that doctor or nurse is recommending. Now, let's translate that to the emergent or urgent type activity. All of that needs to happen at light speed. And so if we treat our patients as consumers and then we already know this stuff, then when they do come in and it's emergency, we're not trapped in a bunch of paperwork or a bunch of gathering information. We go straight to treatment and we can know what the background is. And that would certainly help. Urgent care, emergency care, I'd like to see that be highly tied into the rest of the care I get. I don't always get to choose where my emergencies happen. But if it was connected, then I'd have a lot of trust that these people already know me and aren't going to give me a medication I might be allergic to or a treatment that is counter to what I need through no fault of their own.
So help me and the audience visualize this, right? What role does modern technology play in enabling a consumer-like experience in healthcare, and how does that look like in your perfect vision of how technology will help us change the experience?
Oh boy, it can help in so many ways. I think the one that people often talk about is using AI to listen so that the doctor isn't typing, instead they're talking to you. That is an immediate consumer piece where I'm now talking to my doctor. Doctors went to school to treat you and get you better, not to type into an EHR. But that's what they do. And when I explain to people in other industries or my friends, like, what are those systems? Well, that's the one that the doctor turns away and clicks and types and clicks and types instead of listening to you. So I think immediately, if we can incorporate pieces like that, all of a sudden our patients, now consumers, they're engaged and they're much more willing to do behavior change. Why is that important? Most conditions that we try to address with apps and technology have a lot to do with changing your behavior, whether that's how you eat, how you exercise, how you think of yourself from a mental health perspective. All of those pieces are very hard to change. And one of the better examples I've heard is you may call me as the doctor, Mateo, and if I'm a smoker, but I also am overweight, I might only want to work with one of those, even though you may want me to do both or one in a different priority. So let's lean in and say, okay, Josh is willing to start exercising, but he's not willing to stop smoking. Well, let's work on that. Even though we want to hit the smoking, but let's have some success at one, and then we can tackle the others if we've built that trust. So being able to identify that versus the insurance companies or the providers identifying these things, stratifying these conditions, and then going after them without even asking me what I'm willing to do. That changes the equation considerably.
So let's talk a little bit about AI, right? And many times when we talk about AI, it's I was reading something today. The way that the leaders of certain companies are talking about AI, it's always to scare the population, right? Oh, AI is going to take all of the white collar jobs. AI is going to, but there's a future, like some people call it like a Star Trek type of future, where
Mm-hmm.
AI is just working alongside us and helping us get rid of certain tasks where we don't have the time, right? And humans to focus on where we really add value. What's your vision on that? And what will you say to even to the hospitals and doctors that may be sort of against technology? I know it's an open question, right? But do you see pushback from the doctors, from the hospitals, from the insurance carriers, or people, or and what will you say to that and how that can change?
Sure. You're right. I do see a lot of fear and worry, fear, uncertainty, and doubt, as they say. The biggest things, though, I do see some curiosity. Like, what is this thing going to do? And it's really down to what's the reason. Are they worried that it's going to take their job,
Yeah,
or are they excited that it could help them accelerate their work? And I view it as something that's going to accelerate the work and allow them to treat patients better, maybe faster. There's a lot of different metrics that could happen from an insurance side. It can certainly help with everything from call centers to processing claims. And the biggest worry often comes up is, what if the AI does it wrong?
yeah,
Right? Because it's going to do it at scale. So it's not going to do wrong for one or even a dozen people. It's going to do it for thousands very, very quickly. So the rigor, the ethical pieces and moral pieces of that, and the governance and oversight become 10 times as important because of the scale. At the same time, boy, would it be great to be able to connect the dots that were always so difficult in the past. Another example would be, uh, I highly, highly respect doctors and the vast things that they keep in their memory.
yeah,
It baffles me. I cannot keep all of that in my own memory. Uh, but if I had a tool where I could listen to all of the symptoms and what the patient is saying and their entire history, which I may not have, and correlate that, then at least I could have a list of things that have been ruled out or ruled in order to treat them better. So what those are all pieces of AI that I can believe doctors would adopt, some earlier, some later. Where it gets a little bit on the edge is this whole idea of diagnosing.
yeah,
So at the very all of the systems I've seen so far, at the very end, a human reviews it. And that may be where we stop and where we continue. But to your Star Trek point, maybe it can diagnose or can diagnose specific things better than others.
yeah,
And I'd like to see that happen, or at least be experimented with and understood to see if that can be. And that really opens up then what is the physician doing? Well, the physician is treating, and the physician is helping elicit all of that information, aided by technology that can look at you and
yeah,
without doing a PHQ-9 to screen for mental health, can figure out from your face, your tone of voice, are you depressed? Are you anxious? Right? These
yeah,
are all things that elevate elevate the provider. From a flip side, and this is one that's been rattling around in the back of my head. When I worked for one of the largest payers here for many years, one of the things that happens in the call centers is that we want to get people off the call as fast as possible. That's why self-service is there. Having people call in is expensive. And so there's all these metrics. At the same time, we have an aging population that is often lonely.
yeah,
And so sometimes they will call in and they will keep talking and they want to talk.
Yeah.
We want them off the phone. So you have two opposing pieces. With AI agents and whatnot, suddenly have the opportunity, let them talk. The incremental cost of having somebody talk to an AI is a lot smaller than an actual person, and you might gather some really, really important information over time. That person might be happier. And one of the things you have to watch out for is the creepiness factor
Right.
or breaking that trust. Because if at one point that consumer starts to think that, oh, I'm talking to a machine, I feel betrayed, I
Yeah.
hate you. It can go south really fast, but it can also go very, very well if you have a good implementation. So now you have longer calls, and that's a good thing versus shorter calls that may or may not address what that consumer is looking for. That's kind of an interesting one where the entire model would flip upside down, and I believe you'd see NPS scores go up, and you might even have a lot more trust about what's next. So, okay, you helped me with my weight loss. I will try your smoking cessation program.
Yeah. Where, if you had to score the current implementation uh, path or status, what score will you give to implementation status to healthcare today in terms of adopting technology that could change the way things are done?
Well, if 10 was we're already there and it's everywhere, we are nowhere close to that. And if zero, where we hadn't even looked at it, I would say maybe a two or a three. I think there is so much more that we could be doing, and other industries that are less regulated and don't have to do with your life and health and the emotional side of that. They're much further along. I think we can borrow from a lot of that, but we'll need to step carefully and surely in order to get there. Uh, I just went to the doctor a couple of weeks ago, and uh, there was, to my knowledge, I didn't spot any AI happening in
Yeah.
there, with the exception that my doctor actually looked at me and talked to me the whole time. So
Right.
perhaps it was recording in order to convert that to notes, and that he could review those since there are sometimes still some inaccuracies or flubs along the way.
Do you think the biggest hurdle is more about regulations and risks than cost? What do you think?
That's a good question. I'd actually say neither. I think it's fear.
Fear.
Yep. When we see the self-driving cars out there, I know many people that will never say, I'll never get in that. And it
Yeah.
doesn't matter if their driving record is better than any person alive. There's a nervousness there to hand over control to a machine. Yes, it's costly, right? And yes, there's rules and regulations, but rules and regulations usually come up with by protecting patients, protecting providers and others. So you can kind of track that back to fear. Like, I don't want anything to go wrong, so protect me with rules and regulations. That's where how I would answer that question.
Do you think the technology industry is making itself a disservice by scaring the population and inadvertently introducing that fear? So let me put it this way. I read an article today from Axios basically saying when you hear Dario Amodei or Sam Altman or others talking so much about the risks with AI, that might help them sometimes get investors to pour in money for, because it's like, okay, we are the only ones that can, this is so important, we are the ones that have to carry this forward. But at the same time, I read that AI is very unpopular right now with the population at large. It's like only 26% of the population at large believes that AI is bringing good change, and the rest is like it's going to take away our jobs and it's going to make society worse. So, do you think we are? It's sort of a paradox there, or not so much?
I think there's a little bit of that. We've seen AI make some pretty big mistakes, not just in healthcare, but in other areas. And you're right, we do see companies that are coming in, consulting companies too. Like we're going to come in and put an AI governance framework because you're at high risk. They're trying to sell something and they want to scare you so that you'll buy. And it is important to have all of those protections. But I'd say not just in healthcare, but in general, adoption has been low. And if you go back to what is it, bridging the chasm or crossing the chasm type product thinking, there's the early adopters, and then there's a long gap until you get the rest of the people. We're in some ways part of that gap right now. I know Microsoft is putting a lot of energy in getting people not just to have Copilot, but to actually use it and helping people understand how to best use it and be open-minded about it. It's going to be the same way in other industries. And I think it's incumbent upon us to do a couple things. One, uh, AI for AI's sake is just as good as technology for technology's sake. It doesn't really, it's a solution looking for a problem,
Yeah.
which is why consumerism is so important. We need to sit down, watch the doctors, watch the clinicians, watch the back office, watch the patients, and see what they're running into and identify where the problem is and then apply the right technology. There's nothing new in that, but I think we get so excited about AI, and especially from a financial perspective, we don't need as many people or we can make more money, that part gets lost. All I need is AI. Well,
Yeah.
it might
Wow.
not be the right solution to a particular problem, you know. Um, right down to when you walk into the hospital, what is that experience? What does it look like? What are even the colors on the walls? There's innumerable studies that have vastly improved how care is given by treating the patient way ahead of that.
Yeah.
And then when AI comes in, it can augment, facilitate, or make that better. So I do agree to a certain extent that there is some fear mongering happening. But also, I think if someone fears it and doesn't use it, whether they're the consumer or the provider, I think they're missing out. And eventually, if they're worried about losing their job, they'll not lose it to AI. They're going to lose it because they're not using AI.
Yeah. Yeah. So let's think about the best outcome possible. And what do you think needs to change in the next 5 to 10 years in terms of policy, culture, or technology to make that best possible outcome possible?
Well, I guess I'd go through a few items. Number one, I think we need to invest a lot more into the consumer experience
Right.
with researchers going out and talking to the consumers or providers or payers, like I was mentioning, so that we have our North Star and can line up technology with it, whether that's very simple technology or advanced AI. There's a lot of opportunities there. Secondly, we definitely need to work on making AI less scary, to your point,
Yeah.
and show what it does and does not do. And then find some cases where it made a big difference. And the example I gave earlier, by being able to search through all of the medical research and all of the conditions and manuals and so on and so forth, AI and other tools can do that in a fraction of the time that a doctor could. They can't even read all the documentation in their specialty. It's
Yeah.
too much. So I think if AI could come up with a short list for them to understand and it was deterministic so they know where it came from, I think that would do a lot. The black box model, if you've worked with providers, doctors, they do not like this is the answer and I don't know why. So
Yeah.
I think if we focus on those pieces, I think those will be the baseline. From there, it's going to be using AI in ways that make the patient or the consumer's experience better. I'd much rather have my doctor looking at me, talking to me, and actually listening than typing. And so getting that into the clinical setting, wherever it can be, it is really going to make the biggest differences. From there, regulatory policy, that's a slow moving ship. It's the oil tanker, so to speak.
Yeah.
It's going to take a long time. I think there's going to need to be protections for where AI is used and guardrails were for the same reason. Uh, we're just not going to have enough people to care for everybody if we don't start taking advantage of these tools. And then, just PR. Long time ago, people thought computers were going to take everybody's job.
Yeah.
We can't find enough technologists. So
Yeah.
yes and no, right? And I think it's going to be the same, where uh, we're going to see in all industries um, that there's going to be higher demand because more cool things can be done. I used to have teams that wanted to build on their own, but when we used off the shelf, they could now focus on IP, which is super interesting rather than mundane components. So I think we'll see some of that as well, Mateo. Application of models, augmentation of models, and then essentially a lot of PR to help people across that chasm.
I love it. I love that view. Josh, this has been an amazing conversation. Thank you so much.
So,
Um, Definitely need to stay in touch and continue this conversation as things evolve. So maybe we do another episode in
oh, that
not
would be
a distant
fantastic.
time.
That would be fantastic. Thank you so much, Mateo, for having me on. Super conversation, lots changing, and I'm sure if we talked even in a month, a lot more will have changed.
Yes, sir.